How do financial management principles shape health and social care? This video explores the core concepts of managing financial resources effectively. Discover how budget management, costing, and funding sources impact decision-making. Budget management involves tracking income and expenses. Each department often has its own budget. Department managers oversee their budgets. Budgets help determine necessary funds for activities. They also monitor income and expenditure. Budgets indicate required funds for activities. They ensure financial accountability and transparency. Monitoring income and expenditure is essential. Budgets lay the foundation for financial management. They provide a clear financial overview. Be conservative in budgeting. Involve team members for accurate estimates. Allow ample time for budget preparation. Documentation should be clear and accessible. Ensure all involved parties agree on the final budget. Cost-benefit analysis evaluates alternatives. It identifies the best approach for benefits and savings, used in business and policy decisions. It compares completed or potential actions. Helps in evaluating decisions or projects. Fixed costs remain constant over time. Variable costs change with business activity. Fixed costs are unaffected by production volume. Variable costs fluctuate with production changes. Understanding these helps in financial planning. Expense auditing is crucial for risk management. It helps maintain profitability. Auditing preserves the bottom line. It's essential for processing expense reports. Bookkeepers and accountants often handle this task. Budget profiling translates annual budgets into activities. It focuses on spending within budget annually. Monthly activity monitoring is less emphasized. Budget holders control annual spending. Profiling aids in financial management. Staff involvement in budget management is beneficial. It offers diverse perspectives. Discussing costs becomes easier. It trains junior staff in budget management. Developmental opportunities arise for all involved. Costing gauges overall business expenses. It's a tool for expense management. Costing principles aid in planning cost changes. It involves inventory valuation and pricing. Costing impacts business decision-making. Correct. Stakeholders have vested interests in business. Engaging them is crucial for financial management. Incentive plans prevent carelessness. They motivate employees for better performance. Stakeholder engagement impacts financial outcomes. Accurate data ensures precise costing. Quality data input is vital. Service user-level costing is crucial. Staff activity data contributes to accuracy. Data accuracy impacts financial decisions. Transparency is key in the costing process. Documentation must be clear. Identify data sources and cost classifications. Understand resource cost and activity relationships. Transparency ensures accurate financial reporting. Organizations set cash limits for control. Proper recording of cash transactions is essential. Receipts are filed as source documents. Cash control impacts financial stability. It's a fundamental aspect of financial management. Internal audits assure management of effective processes. They evaluate risk management and governance. Internal controls are assessed for efficiency. Audits provide independent assurance. They are crucial for organizational health. Funding is vital for business growth. It can be short-term or long-term. Sources include retained earnings, debt, and equity. Each source has its own implications. Funding decisions impact business strategies. Retained earnings come from business profits. They can be reinvested or distributed as dividends. Companies decide on capital allocation. Earnings support new projects or ventures. They are a primary funding source. Debt capital involves borrowing funds. Companies issue debt securities for cash. Debt requires timely interest and principal payments. Borrowing impacts financial obligations. It offers a structured funding approach. Equity capital involves selling ownership stakes. Shares are issued to investors. No interest payments are required. Profits are shared among shareholders. Equity impacts ownership control. Other funding sources include private equity. Venture capital and donations are options. Crowdfunding raises funds from many individuals. These sources have unique characteristics. They complement traditional funding methods. In conclusion, effective management of financial resources is essential in health and social care. It ensures services remain sustainable, cost-efficient, and responsive to user needs. By applying sound budgeting, monitoring, and accountability practices, organizations can deliver high-quality care while maintaining financial stability and long-term success. If you have any questions, please feel free to reach out via WhatsApp or email. Thank you.